Pregnancy is an incredible journey filled with anticipation and joy. It's also a time of significant physical changes. One common change is swollen feet, especially during the third trimester. Don't worry, it's usually normal. This guide will help you understand and manage swollen feet during pregnancy. During pregnancy, your body undergoes numerous changes to support the development of your baby. One of the most significant changes is the increase in blood and fluid volume. This is essential for providing the necessary nutrients and oxygen to your growing baby. Your body produces about 50% more blood and fluids during pregnancy, which is a substantial increase. This additional fluid helps to meet the needs of the developing fetus and the placenta, which is the organ that nourishes the baby throughout the pregnancy. However, this increase in fluid volume can lead to a common condition known as edema or swelling. Swelling is most commonly noticed in the feet, ankles, and legs, but it can also occur in the hands and face. This is because the extra fluid tends to accumulate in the lower parts of the body due to gravity. Swelling can be uncomfortable and sometimes even painful, but it is usually a normal part of pregnancy. Additionally, as your baby grows, your uterus expands and puts pressure on the veins in your lower body, particularly the large vein on the right side of your body called the inferior vena cava. This vein is responsible for returning blood from your lower limbs to your heart. The pressure from the growing uterus can slow down this blood flow, causing blood to pool in your legs and feet, which further contributes to swelling. Elevating your feet when resting can help alleviate some of this pressure and reduce swelling. Hormonal changes during pregnancy also play a significant role in fluid retention. One of the key hormones involved is progesterone. Progesterone levels increase during pregnancy to help maintain the uterine lining and support the growing baby. However, progesterone also has a relaxing effect on the walls of your blood vessels. This relaxation can slow down blood flow, making it easier for fluid to leak out of the blood vessels and into the surrounding tissues, leading to swelling. It's important to note that while some swelling is normal, excessive swelling can be a sign of a more serious condition called preeclampsia, which is characterized by high blood pressure and can be dangerous for both the mother and baby. If you experience sudden or severe swelling, especially in your hands and face, or if it is accompanied by other symptoms such as headaches, vision changes, or abdominal pain, you should contact your healthcare provider immediately. Regular checkups with your doctor can help monitor your condition and ensure the health and safety of both you and your baby. Staying hydrated is crucial during pregnancy, as it plays a vital role in maintaining both your health and the health of your baby. Water is essential for the formation of amniotic fluid, the production of extra blood, the building of new tissue, and the transportation of nutrients. It also helps in digestion and flushing out toxins from your body. Even if it seems counterintuitive when you're already retaining water, drinking more water can actually help. Swelling or edema is a common issue during pregnancy, especially in the feet and ankles. This happens because your body retains more fluid to support you and your baby. However, staying hydrated can help manage this swelling. Drinking plenty of water helps flush out excess sodium and actually reduces swelling. When you drink enough water, your body is less likely to retain fluids. This can make a significant difference in how you feel day to day. Plus, staying hydrated can help prevent urinary tract infections, which are more common during pregnancy. Aim for 8 glasses of water daily. This might seem like a lot, but spreading it out throughout the day makes it manageable. You can start your day with a glass of water, have another with each meal, and sip on water in between. Keeping track of your water intake can help ensure you're getting enough. Carry a reusable water bottle with you to remind yourself to stay hydrated throughout the day. Having a water bottle on hand makes it easier to drink water regularly, whether you're at home, at work, or on the go. Choose a bottle that you like and that is easy to carry around. Some bottles even have markers to help you track your intake. You can also add slices of cucumber, lemon, or other fruits to your water for a refreshing taste. This not only makes the water more enjoyable to drink, but also adds a small amount of vitamins and minerals, or mint to your water for a refreshing taste. Mint can help soothe your stomach and improve digestion, which can be particularly beneficial during pregnancy. Experiment with different combinations to find what you like best. Staying hydrated doesn't have to be boring. It can be a delightful part of your daily routine. Elevating your feet whenever possible can make a world of difference. Lie down on your side with your feet raised above your heart level for at least 20 minutes, several times a day. You can use pillows, cushions, or even a stack of books to elevate your feet. This simple practice helps improve blood circulation and reduces swelling. Comfortable footwear is essential during pregnancy, especially when dealing with swollen feet. Avoid tight shoes and high heels. Opt for supportive shoes with a wide toe box and breathable material. Consider wearing compression socks, which gently squeeze your legs and feet, promoting blood flow and reducing swelling. They are particularly helpful during long periods of standing or sitting. Section 6. Moving your way to less swelling. Regular physical activity can do wonders for reducing swelling. Gentle exercises like walking, swimming, and prenatal yoga improve blood circulation and help flush out excess fluids. Even short walks throughout the day can make a difference. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Always consult your doctor before starting any new exercise routine during pregnancy. Expanded. Chapter. Section 6. Moving your way to less swelling. Pregnancy can bring about many changes in your body, and one common issue many expectant mothers face is swelling, particularly in the feet and ankles. This swelling, also known as edema, can be uncomfortable and sometimes even painful. However, there are ways to manage and reduce this swelling, and one of the most effective methods is through regular physical activity. Regular physical activity can do wonders for reducing swelling. Gentle exercises like walking, swimming, and prenatal yoga are particularly beneficial. These activities not only help in keeping you fit, but also play a crucial role in improving blood circulation. When your blood circulates more efficiently, it helps in flushing out excess fluids that can accumulate in your tissues, thereby reducing swelling. Prenatal yoga, for instance, is a fantastic way to stay active during pregnancy. It combines gentle stretching with deep breathing exercises which can help in reducing stress and improving overall well-being. Additionally, the various yoga poses are designed to enhance blood flow and reduce fluid retention. Swimming is another excellent option. The buoyancy of the water supports your body, reducing the strain on your joints and making it easier to move. Even short walks throughout the day can make a significant difference. You don't need to engage in strenuous activities. Even a leisurely stroll in the park or a walk around your neighborhood can help. The key is to keep moving and avoid sitting or standing in one position for too long. This movement encourages better blood flow and helps in reducing the buildup of fluids in your lower extremities. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be broken down into shorter sessions if that's more manageable for you. The goal is to stay consistent and make physical activity a regular part of your routine. Besides reducing swelling, regular exercise during pregnancy has numerous other benefits, including improved mood, better sleep, and increased energy levels. Always consult your doctor before starting any new exercise routine during pregnancy. Your healthcare provider can give you personalized advice based on your specific health needs and pregnancy progression. They can also recommend the best types of exercises for you and ensure that you're staying safe while staying active. Remember, the goal is to keep both you and your baby healthy and comfortable throughout your pregnancy journey. Section 7. Eating for reduced swelling. A healthy diet can also contribute to managing swelling. Reduce your sodium intake, as excess salt can worsen fluid retention. Avoid processed foods, fast food, and salty snacks. Focus on consuming potassium-rich foods like bananas, spinach, and sweet potatoes, as potassium helps balance fluids in your body. Section 8. When to seek medical advice. While mild swelling in the feet and ankles is common during pregnancy, certain symptoms warrant medical attention. If you experience sudden or severe swelling, especially if accompanied by headaches, vision changes, or pain in your upper abdomen, contact your doctor immediately. These symptoms could indicate a more serious condition called preeclampsia, which requires immediate medical care. Section 9. You've got this, mama. Swollen feet are a common and manageable part of pregnancy. By following these tips, you can alleviate discomfort and enjoy this special time. Remember to listen to your body, rest when needed, and seek support from your healthcare provider whenever you have concerns. You've got this, mama.